Sarah, introduce yourself, please.
Another Sarah is there, ma.
Okay, I could not hear Sarah's voice. Probably your network is not so
Good evening, ma. Sarah is there, ma.
okay. All right, all right. Please introduce yourself and tell us where you are joining us from.
My name is Anwade Sarah, and I am from Christian University.
Wow, that's great. You are welcome.
Thank you, ma.
Okay, Sultan, can you introduce yourself?
Yes, thank you. My name is Abdullah Ashu from American University of Niger, Mariam Abacha. I'm a medical laboratory scientist.
Wow, great. It's great having you on board. Thank you.
Thank you very
Also,
much.
can Pomile introduce herself?
Yeah, thank you. I think that is all.
All right. Kasim Obi. Okay, okay. Thank you, Sultan. It's great to have you with us.
Thank you very much, madam.
You're welcome. Can Blessing F. Young please introduce yourself and tell us where you are joining us from? If Blessing is not here, Elizabeth Ajayi, please introduce yourself.
Good evening, ma.
All right.
My
So where
name
are
is
you joining?
my
Okay,
name
your
is
name.
Elizabeth. My name is Elizabeth. I'm joining you from Christian University.
All right. It's great having you with us. Thank you. Esther Akpan, can you introduce yourself?
Okay, good evening, everyone.
Good evening.
I'm Esther from University of Jos, Plateau State.
Wow, it's great having you with us. Thank you. Alabo Dakoru, please pardon my pronunciation. Please introduce yourself.
Good evening, everyone.
Good evening.
My name is Mr. Labo Dakoro from the University of Calabar. Currently in Port
Wow.
Harcourt. Joining from Port Harcourt
Okay.
currently.
Okay, okay. Thank you so much for joining. Thank you. Ability Moses, please introduce yourself and where you are joining from.
Okay, good evening, ma.
Good
My name
evening.
is Ability Moses from University of Uyo, Kwabem State.
All right, great having you on board. Tolu Adekombi, please introduce yourself.
Good evening, everyone.
Good
My name is
evening.
Adekombi Tolulope from Chrisland, ma.
Wow, it's great having you on board. Baka Basila, please introduce yourself.
Good evening, ma. Basil about our Federal University.
Please, we cannot hear you properly. Can you increase your voice?
Good evening, ma. My name is Basil Abaka from Federal University Bukari.
Okay, wow, it's great having you with us. Thank you. Oyinlola, please introduce yourself. Is Oyilola with us, please? All right. Can Uloma introduce herself? Okay, so now I'll just call our names and you tell us, you just say Mba Joshua, Ayobami Esther, Awaji Ikakinwene, Aleku Jacob, Alabo Dakori. Just say hello, just say hi. Hello, John. Development testimony. Ipioluwa Akinwale Haruna Tubai Abbas, Josephine Jude, Kasimobi Ede, Kende Favor, Kolawole Adeyemi, Latif Abdulbasit, Mabel Omoniwa, Meritonia, Mba Joshua, Moyosori Adetunji, Odusanya Enoch, Olaire Ayomipe, Olawunde Daniel, Oluwabumi Tùmẹ́ni,
Hi.
Oluwatomilétani. Hello, you're
Hi.
welcome. Ọ̀rẹ́olúwa Mary, Ọ̀sùnsànyà Olúwaṣeun. Hello, Oyedeji Nífẹ̀mí, Oyinlọ́lá Ẹ̀dùn, Yíran Tashin, Fonzik Justin, Righteous Alagbe, Promise Wabo, Saidat Met, Samuel Enoch, Stephanie Andrew, Temiloluwa Májẹ̀kódùnmí, Udezuka Uloma, Victor Amedu, Wazi, God Save, Winner Falaju. You are all welcome this evening. It's great having every one of us on board. So please, can we all mute ourselves? Can we all mute ourselves? Please mute your device. So once again, you are welcome to the Biomedical Science Conference 2024, and it's great having every one of you on board. I'd like to recognize the presence of the MedLabConvo Executive Director, Glory Ayobami Ogunmodede. You're welcome, Ma. I'd also like to welcome the members of MedLabConvo, the team members, the organizers of this conference. To everyone online, a big shout out to you all. Ekene, Nelson, you're welcome. Paul, Confidence, Daniel, you're all welcome on board. It's great having every one of us here. Pomile, it's great having you on board. Yes, so I believe we are all good and we are anticipating the session already. Yes, I'm also anticipating it. Yeah. Can I see your excitement in the chat box? Please don't let it be dull. Let's make use of the chat box. You can make your emoji. I can see some of us have been introducing ourselves already. Mabel Omoniwa from Aminu Kano Teaching Hospital. Yeah, Iwelomen testimony from University of Benin, Edo State. Yeah. So can we show the excitement? So this evening is going to be really packed. Yes, it's going to be really packed, a powerful one. And I want you all to be rest assured that, as usual, MedLabConvo is coming to give you value. You definitely get value, and Okay. All right. So I'd like you to keep introducing yourselves in the chat box. Yeah, I can see our responses. I'm excited to be here. I can't wait to learn. Yeah. So you can keep introducing yourselves in the chat box. I can see Alabo Dakoru from the University of Calabar. Thank you for joining us. And Maidi is saying MedLabConvo is 100% or nothing less. We are ready. Yes, so and then Kolawole Adeyemi Emmanuel from Ambrose Ali University, Justin Ponzip Landing from Ahmadu Bello University, Zaria, Promise Irabo from Ambrose Ali University, Effiong Blessing from Clifford University. Wow. It's glad to have you. So I'll be inviting our executive director for the speech. So we'll be having the ED speech right now. Can we jam our hands together for our the executive director of MedLabConvo?
Good evening, everyone. Thank you so much
Good
Maria,
evening,
for
Glory.
the warm welcome to everybody. And sorry for stepping in late. I want to say I'm super excited to have everybody here. If you followed MedLabConvo for before now, you would know that we are passionate about ensuring medical laboratory science students and young professionals become the best version of themselves in the laboratory and even beyond the laboratory. And every program that we've organized so far and we'll be doing subsequently are in alignment with this mission, right? And the Biomedical Science Conference is just one of those ways we have in plans to help everyone attain the best they can in the profession. So as you come tonight, I want you to be ready to learn. Ensure you have a note somewhere because we did not just choose our speakers like anyhow. We chose them purposeful to impact you. I trust that you're going to have a great experience. Once again, thank you for signing up for this program, and I hope it would be worth your time. I believe so. Medical is 100% or nothing less. So welcome everyone. Enjoy the session. Thank you, and over to you, Victoria.
Thank you so much, Glory. It's great having you with us. and I believe every one of us is getting excited already. So yes, we'll be moving to the first session of the biomedical conference. We are moving to the first session right now, and I'll be introducing our speaker to us. Enlightening John is a quality-driven professional with a biomedical science background. She has vast experience promoting quality, bridge the convenience gap, and increase patient satisfaction. She presently works with laboratories and national programs across sub-Saharan Africa to maximize the financial and operational benefits of automation adoption in the medical diagnostic market. So can we welcome our speaker for tonight, as she is going to be speaking with us this evening. Yes, she's going to be speaking on the guidance of quality and patient safety, biomedical laboratory sciences. Are we excited to have her on board? MedLab scientists, guidance of the guidance. Can I see our clap? Yeah, so you're welcome, ma'am.
Thank you very much. Thank you so much. I'm really happy to be here. Thank you. Sorry, can you hear me?
Yes, we can.
Okay, hello everyone. Thank you so much. Yes, I'm really happy. It's been a very it's my pleasure. It's been an honor to be in your presence today. Thank you. Do I go straight into my session?
Yes, ma'am. Please go ahead.
Okay, thank you. Second. Tell me if you can see my slide. Okay. So hello everyone. My name is Enlightening John. I am a medical laboratory scientist by training, and it's really a pleasure to be here. I have worked on and off the bench for a couple of years, so I was very excited when I was invited for this talk. So today I will be talking about quality in patient safety, the essential role of laboratory practitioners, basically. And we would hear from a lot of speakers today from the perspective of a laboratory. I have been away from the bench for a few years, but up until this point, everything I have done has been from my knowledge of the bench. As a medical laboratory scientist, you would understand the importance of a zero margin of error to patient safety. So in this sense, I would talk about laboratory, essential quality services from the laboratory that would guarantee patient safety. But more so, I'm going to look at it from the angle of the entire organization. It won't be limited to the laboratory, because if there's quality in the laboratory and there's no quality outside of the laboratory, your job is not going to be effective. So I'm going to speak about quality in the laboratory and outside, which I'm going to widen my scope to the entire organization, and then to guarantee patient safety. Yes, these are the objective. So according to WHO, we know that patient safety is basically healthcare that provides equitable, effective, a patient-centered, timely, and efficient services. When it's equitable, if I'm a person that comes into the laboratory, into your organization, I expect that the standard of care does not discriminate. It goes round to everybody. There's quality round. It's obvious. There's no discrimination between these people can afford the higher class and then the lower class, or based on gender. Quality is exceptional. Quality goes round everything. it's effective. When we're talking about it's effective, we are taking away all the time wasters. So for instance, we look about the total testing in the laboratory, from the pre-analytical to the analytical and then the post-analytical. What are the things that you can find in the laboratory that waste your time? I'm going to give an example. While I was a quality assurance manager in my organization, there was a COVID era, and if you know, there's usually, some people say there's a peak in healthcare from the period of February to about August. Everybody says people are always coming into the hospital, so there's an inflow. And then for some strange reasons, they say when it's August to December, people stop going to the hospital because they want to save for the festive period. So about that time, there's a lot of people, there's a crowd of people coming to the organization. And then you discover that everybody is going on the same queue. So if you want to make inquiries on how much is your test, what test do I do, you discover that everyone is on the same queue. There's a whole crowd. That was not an effective system. And I'm a very firm believer of not wasting my time. So if I'm someone that comes into your organization and that's a queue, it's not effective. So it's narrowing down what is effective. At the end of the day, I had to do a division when I became a QA manager. We had a table where the nurses go in and then they speak to the people that, oh, what do you want to do? More so the elderly people that are not very sure of what they came to do because they are just monitoring their health status. So the nurses are like, oh, what do you want to do? How can we help you with in cases where you're not sure? And that drastically reduced the line in the organization. So when we're talking about effective, what can you see in your organization that is a time waster? What can you see in your organization that is a resource waster? These things don't make your process effective. And when we're talking about patient-centered, everything you are doing, every contribution has to go, it has to be patient-centered. It has to be focused on your patient. It has to go with your patient values, from your pre-analytical to your post-analytical. I'm a patient and I come into your organization and I sit down there. That's one thing I want to encourage us from this training. I want us to open our mind to the sense of quality. I don't want us to look at quality, patient safety from the angle of what your resources, what you have provided in your organization. Wherever you are stepping into, you should stand out. You should have a patient-centered thought when you are attending to your patients. What would my patient prefer? How would I address my patient that would stand me out? For instance, when I started from an end, when I was when I was serving, I was fortunate to work in a strictly diagnostic center. And when the patient came in, that was when we were getting the ISO accreditation. We were about to get into the process of the ISO accreditation. I remember I was retained immediately after my service and I grew into the QA position. So when I got in, it's like they were being trained how you were going to attend to your customers, how you were going to give them exceptional service. And then we got to improve ourselves. When patients come in from the pre-analytical, we're asking them, oh, excuse me, how are you? Welcome. What is your name? And then we're telling them, oh, we're going to be taking 4 meals of sample from you. It's going to be a little bit of a prick and a bit of a sharp pain. It's your candor, the way you attend to your patients. It has to be patient-centered. Another thing, it has to be timely. If you worked in a quality laboratory, or if we're going to be going into a quality laboratory, there's a point where you check from when the patient came into the organization to the point when the result is going to come out. For instance, let's say we have a TAT of 30 minutes for PCV, for instance, in your laboratory. The timeliness starts from when the person comes into the organization to when the patient gets a result. So your services has to be timely. If you say it's 2 hours, 2 hours is 2 hours. If there's going to be a delay, you communicate your 2 hours. And then it has to also be efficient. It can't be effective and equitable and not be efficient. What are your processes? What are the things you've listed out down and said, this is what we are going to be doing. This is the methodology. This is our SOP. This is our this is our workbench. This is our workstation. This is basically what we're going to do to achieve this result. It has to be efficient. For instance, you can. I remember I recently went to a medical museum. And it was very wonderful. At first, we thought we were just going into the medical aspect of the museum. And then they took us to the diagnostic room. And they were like, oh, this is the centrifuge that was used in the medieval chronicles in the 18th centuries. And I started laughing. And then the lady was like, what happened? I'm like, oh my God, I'm so grateful I wasn't born in that era. Because They had to place the sample in there, and then they had to keep rotating and rotating for an hour before they could make sure that there's a plasma separation. So we cannot use outdated methods in this time around when technology and automation, there has been improvements. So as the time goes by, we have to improve our processes to make sure that they are efficient, to make sure that again they are serving your customers. So now when we're talking about the diagnostic team, at the beginning of this training, I had mentioned that we are going to go beyond just a laboratory. We're going to go around. So when we talk about the diagnostic team, we talk about the patient and the family members right at the core of our services. And then we have the diagnosticians. Now, we're not talking about just laboratory scientists. We're talking about the radiographers. We're talking about the doctors. We're talking about the nurses. Everybody that is part of diagnosing a patient is right in the middle circle. And that's where we talk about collaboration. That's where we talk about fostering collaboration in our jobs. So the next thing we're going to right at the outside is the healthcare professionals who support the diagnostic processes. Now, diagnostic process, of course, we know that the patient comes in. I wouldn't go to the hospital if I don't have a problem. So this is it. I want to do a regular checkup. I assume this is what's happening to me. And then, of course, the healthcare engages me, and then you get my information, my age, my height, the symptoms I was having. And then these things are communicated to every department. So, for instance, I remember there was an age-old conversation that was going on in home for a test, and there would be no prognosis. What is the doctor suspecting? We just see EUCR, and nobody knows what it is. You just said EUCR, and then you're doing EUCR. And then there was a radical change. The director started complaining, and they said, no, you have to tell us what is the patient's information, what is the patient history, what are you suspecting. So our diagnoses are going to go in line with your suspicions. So these are the things that when this information are imputed in a system where there's collaboration, you pick up a form and then you're like, oh, okay, this is what the doctor is suspecting. This is my emphasis. This is what I'm looking at. And then you communicate this diagnosis and then the treatment. That's where the patient center is coming in. It's no longer just about I. It's about what does the patient need? Why did the patient come into this place in the first place? I mean, you can't just wake up first thing in the morning and go to a hospital with no purpose. I don't that makes no sense. So if I dress up and I come there, that means I need something. And if I do need something, your mindset, the service mindset, the health professional mindset, the quality mindset is there to deliver what the patient wants. So when we talk about errors are very predominant in the laboratory. I particularly say nobody's above error. It's how we actually handle the error that's important in the quality scenario. I'm going to give you some examples of while I was a QA, some examples of what I saw, some errors we saw, and how we were able to improve in those time. So when we talk about error, it's something that basically produces a mistake. It's an act. So we are all pulling it. If you see the diagram, everybody is carrying the weight of the problem, but eventually something comes out of it. It's either the patient notices or the patient doesn't notice. So now this is an image I find very funny. So this group of medical practitioners, it's called the Watchdog Group. They were promoting a strategy to end medical errors. So here's this person. They said, you'll be happy to know that we have new procedures that will prevent mistake, Mrs. Brown. And there the supposed Mrs. Brown says, no, my name is Mrs. Smith. So we're trying to improve quality. You found a method to improve quality, yet you called me a wrong name. So these are some medical errors that we think are not occurring, are still occurring. They are a big deal. So when we think about a patient-centered approach in quality of laboratory, we're not just looking at one phase, we're talking about the total testing procedure from the pre-analytical, analytical, and the post-analytical. So now let's talk about the pre-analytical. A patient comes in and then they're like, oh, I want to do this test. And then in the process of doing this test, they're like, my eye or my urine is looking red or is looking blue. And sometimes patients are not very forthcoming with this information. You should have an environment that allows your patients to speak about what is going on. And that comes with our friendliness, our candor. How do you approach your patients? You come in when I say this as a professional. no matter the mood you are in, the mood you woke up, sometimes you wake up with a mood swing. Sometimes you come in and your day is turning upside down. It's like chaos. No matter the mood you come in, when you come into the laboratory, you are a professional. When you come into your business, when you come into your job, you are a professional. More so, I would emphasize that sometimes we think it doesn't really matter. But when we look at it, if you have a business and there's a $10 million deal along the line, and then all you have to do is laugh and kiki and make sure that you are the person that's coming to give you that 10 million naira is going to be happy and bless you with that money. Your appearance is going to change. You would smile. You would be very kiki. Some people would call it kissers. I don't think it's kissers. It's your business. So that's how you come in to the organization. When you have a problem, when you don't have a problem, you are there to be a professional. And when you're a professional, you carry yourself as such. So there's an atmosphere. You know what you are doing. You're having a conversation. Oh, you confirm you want to do PCV. What happened to you? And then from there, a conversation strikes up, and then they tell you that they ate vegetable last week, and since then their stomach has been bloated. And then you become helpful. So another thing we talk about is share information about collection process. If you go to most sorry, please could you mute your mic? Thank you. If you go to most organizations and most international countries and they want to take your sample, I'm sorry, I'm getting a bit distracted. Yes. If you go into most international organizations or in hospitals outside the country and they want to take your sample, they're like, oh, we're sorry, it's going to be a light prick. And then before they do that, the collection process, they tell you, oh, I'm going to be taking 4 mils of blood from you. And then you know what? These things actually have a way of having your clients open up to you. So it's like, oh, I'm sorry, I'm taking 4 mils of blood. And the man says, oh, or the lady says, 4 mils of blood, that's a lot of blood. And then we laugh. And then it becomes a conversation starter. You've gotten into your patient. You've gotten to know more about your patient. And like it or not, knowing more about your patient, getting information is very helpful to help. It's very important to helping your patients. So you describe the self-care after venipuncture. So after you take a sample, you'll be like, oh, just hold your hands up. So these are the processes in analytical that are so important, that are patient-centered. And then when you talk about analytics, you're able to track the number of samples served, you track the number of abnormal and critical values. If you work in an ISO lab, accredited lab, you would realize that if there's an abnormal value, it's tracked. There's a flag. There's a comment, there's something written there that says this is a critical value. And then when you record it in your documents in the laboratory, there's a flag that says this result was abnormal. And this is more so because it allows for repeatability. If there's an abnormal sample, let's say you want to do glucose and then glucose is 800, the patient's glucose is 800 milligram per mole per day, then you're like, oh, what happened? You start thinking, should you do a rerun? Is it my quality process that is an issue? Is it the patient? And that comes with having a conversation with the patient. That gives you, narrows it down. And then it's always advisable when you see a critical value in the laboratory, a rerun is important. So you track the number of patients. And then when we go into the post-analytical, you immediately communicate critical values. You don't wait till a patient comes. Maybe the patient has told you, I won't be around today, I'm coming tomorrow to take your result. You don't wait till next tomorrow evening for you to say potassium is 8.0. These are critical values. That's the whole point of getting the information from the patients, and that's where synergy comes in. So you have a customer care, a customer care office that is supposed to communicate with the patient. You have done your test, and you know what? I say I'm very particular about somebody from the laboratory being a QA person, because if you know the importance of zero margin of error, there's a way you could shape the organization. You tell the customer care that it's a critical value, the patient has to be contacted. The person doesn't know what a critical value is, but you are the professional. You are the one telling them that it's a critical value. So you communicate it to them, and then you put a sense of urgency to it and follow through. So you read back verbal results. So for instance, your colleague is telling you, a colleague is in front of the machine telling you, please write down, which is not advisable. Please write down glucose is 200, 300. Did you say 200? Please, can you confirm? Did you say 300? So these are the things that make your care patient-centered. Now, this is, if you've heard of the fishbowl analogy, so if the pre-analytical is not good, the fish cannot swim to the next one. If the analytical is not good, you cannot expect the quality to the next to the post-analytical. So every aspect of the laboratory, every aspect of the organization is interlinked. Now we're going to talk about key elements that support patient safety. We're going to talk about effective communication. I cannot overemphasize the importance of effective communication. Now, we talk about effective communication to your patients, to other healthcare providers. I had a conference, I think it was 2 days ago. I was in Ghana, and then I was having a conversation with a group of doctors that were doing some research, and then they're like, "Oh, the lab scientists don't want to talk to us. They don't want to do this." It's the same problem we have in the whole of West Africa, sadly. And then I said it goes back to maybe they have had issues with the doctor in the past, and then there's going to be a problem. You don't want a doctor to come into your space. A doctor stays they want to come into that age-old problem that honestly I don't understand what it means. But I feel like in the context, I told them that if I know my job properly and if I can communicate because I know my job properly, you have no business stepping on my toe. It's my job. I know my job. I communicate very clearly. So when you are in the setting and you have to communicate with other healthcare providers, you have to be able to speak clearly and concisely. There's no two ways about it. And that's one of the things that bridges the gap. That's one of the things that make you, people look at you and they say, oh, you know what to do. Because you are not afraid to speak up. You are not afraid to ask questions. You see somebody that is coming in for a test and then the patient's glucose level is so high and then they put the person on a diet because they are not aware. You are not afraid to communicate. You pick up your phone and you're like, oh, doctor, am I the person in charge of this patient? You call the doctor and say, this is what is going on. It's an emergency. And there's a way you can communicate that you're not being condescending, you're not being rude. You are clearly speaking because you are a professional. So that's a fine line that we need to improve on. You communicate not just to your patients, to the other healthcare providers, like it or not, as young professionals, as young laboratory professionals that are going into the profession. What we should be wanting to do is foster a relationship. You're not fostering a relationship just because it's a team, it's patient-centered. If we can foster a relationship that says, oh, okay, this is where my role is and I am very effective, I am efficient at what I can do, I can come on the table and provide the services to you. Please, by all means, communicate clearly. My dad says when you have a seat on the table, sit down and sit down very comfortably. There should not be any doubt as a young professional. There should be no doubt. You know what you are bringing into the table. And more so, you should know what you are bringing to the table when you have grown yourself to the point that anybody that speaks to you can clearly know why you are at that position. So you should not doubt yourself. If you are privileged to be involved in a managerial position, if you're privileged to be sitting down on the table where decisions are being made, come there 100% ready. Come there with the knowledge that you have gotten, with the improved knowledge you have gotten. So also to your patients, there should be no doubt when you speak to your patients that you know what you are doing. There's no, I'm not sure. There's some things that we say as professionals. But I said 2 bottles to this person. But I did this. It doesn't speak there's no confidence in saying. It's not clear what you're saying. And then if I was somebody that was a medical person and then somebody is speaking to me, I would look at you like, do I really want to trust you with my sample? Do I really want to trust you with the services? All you do, come with agility, come with integrity, improve yourself. Now, as a young professional coming off the school, you might not know too much. I was there. I am still there. I am still growing. I am still learning along the journey. Nobody knows it all. At every space you find yourself, you're growing. So at every point in time, don't look at someone else that is doing so well in their job, that has improved, and then you're like, oh, this person speaks so well. There was a process. We did not jump in. We grew in the process. So if you're not so good at communicating, I tell young professionals, if you're not so good at communicating, these are things you learn. You learn on YouTube. You learn by correct whenever you're speaking to your healthcare providers. Grow into it because it's we cannot overemphasize how important it is. We speak about it and we say most times now when a result comes out and then maybe it's hyperuremia, there's always a comment down there that says these are some of the causes of this condition, these are some of the causes of this, or maybe a patient is HIV positive, and then we tell you, we write a comment there that positive for vitamin and positive for the basically the gold standards. So we're telling them that this and this is a step, and then we also give you further information and tell you, please go go and seek further advice from your doctor. We tell you that you're positive for vitamin and Unigold, and then we tell you that please go and see your doctor for further information. So over explanation, offer guidance. I think a part of our training as a MedLab scientist was counseling. I think, if I'm not mistaken, guidance counseling was a part of my training. So how to speak to your patients. You're not like, this your result is high, yo. What are you eating? That's not the approach. So you're like, oh, it's high. Usually it could be as a result of this. But I think you should go see your doctor. That would offer more information on what you could do. If you're being helpful, please be helpful. And then organizational culture. I cannot overemphasize. That's why I said the lab cannot be going well and then the organization is not going, the organization cannot be going well and you expect the lab to go well. I'm very sorry, it doesn't work that way. As a QA, you would know that it doesn't work that way. Everything is linked together, from the communication the laboratory scientists have with the radiographers to the radiologists. Everything is linked together, and more so if the management is not seeing what you are seeing, the laboratory is going to suffer. That's a lot of issues we have right now. So you see laboratories, they're telling you that, oh, we are doing QC and we do calibration and we need this. The management is asking you, what are you doing calibration for? If they are not informed, if they don't know your quality process, nothing is going to work. You end up discovering that you're begging people for money for reagents, you're begging people for money for to buy QC and calibrator. That's because there's no culture. You have not formed the culture. So if one is not working, the other one is not working. That's why I'm employing you as young professionals. You are going to be going into the field. You would be going in there, and fortunately you would have to support. You might I believe you have to serve before you be a leader. So while you are serving, there's a way you can put things in order while you're there. So you're getting the data and you're telling them that we have to do QC for patients. This is the rules for the QC. And you're telling your manager that, sir, this is what we, and you're not saying it in a condescending manner. I think if there's one thing all my managers, they say in common is, if Aina needs it done, she will get it done. I will find a way to get it done. You will do
Please
it. I
excuse
would
me.
not be rude, but I will give you all the data. Sorry?
Please, your screen is down. We cannot see your
Yes,
screen.
please.
We cannot see your screen, please.
First of all, hold on. I don't know why that has happened. Please give me a second.
All right, ma'am.
Oh, sorry. Is it? Can you see my screen now? Sorry, can you see my screen?
Yes, thank
Yes,
you.
we can see.
Yes.
Okay. So when you sit from wherever you are, try to make a difference. So now we have a normal response to medical error. You have an error that happens in the laboratory. Everybody's like, oh my God, Victoria made this mistake. Or somebody's like, Nifemi made this mistake. And then everybody's like, it's because of Nifemi, this patient is going to happen. That's usually the normal response to medical error that we have in the organization. But we should have to handle this in a non-punitive manner. So if there's an error and then you don't have an environment where people can learn, I say this, and I always say this to my manager. I said I'm grateful because I know that I can make mistakes and learn from my mistakes. There's no fear that I can make from my mistakes, because if I make a mistake, I call and I'm like, oh, this is what I did. I think I could have handled it better, and I am confident and I know that I would not be getting a pushback from my manager. So as young professionals that are going to grow into those positions, that even where you are, you should not be looking at, oh, maybe, for instance, myself, Nifemi, Salter, and Victoria, we work in the same laboratory. And then maybe Nifemi took two samples or 3 meals of sample. And then you're like, Nifemi is always making this mistake. You have not trained Nifemi to change. There's never been, we haven't sat down together and said, Nifemi, this is what you are doing wrongly. You just assume Nifemi is going to change. So address medical, the response should not be criticizing this person, because believe it or not, If Victoria is doing well, the whole laboratory is doing well. If Victoria is not doing well, guess what? They're not going to say it's Victoria in the laboratory that is not doing well. They say, is it not all those laboratory scientists that are inside there? They don't know what they're doing. They don't know anything. Have you heard those kind of comments before? Sometimes it's not even because of one person did so. It's not because of the whole laboratory doesn't know what they are doing. It's just because one person made a mistake. So it's important that you don't address medical errors in a critique. You don't criticize people. You should look at it. How can we improve? How can we make sure that our processes are better? So definitely recognize where the problem lies. So is the problem a process flaw? Is it a managerial error? So definitely, and also it's important that you report this problem. It's a mandatory reporting law. When you are privileged to work in a quality assurance laboratory, in an ISO laboratory, you would know that you have to report every error that happens in the organization. So I'm going to give an example of something that happened while I was back in the lab. I think a patient came in and then they said, for instance, their name is Habib Kaizam. And then they wrote Habib Kaizam, and then the patient goes in and they said, my name is not Habib Kaizam, my name is Habib Folashola. And then it became a big issue. They're like, why are people always making a mistake? They went back to their front desk and they're like, why are you always making a mistake? Why is this always happening? So I was invited, of course, QA. I was invited to come down to say this is what was happening and this is not the first time this error is happening. How do we correct it? And then immediately I revised the policy. Because of course we have written policies, written SOP. So I thought about it. I'm like, I had a meeting with everybody concerned. I'm like, how can we prevent these errors from re-happening? Because believe it or not, it could be anybody. I could be tired right now, and then you tell me your name is Habib Fola, and I write it. So, and then they were like, the other group was like, no, the patient told me that that was their name. And then even I went to meet the patient. I'm like, please, is your name, do you have any name that is this on your list? And then the patient says, no, that is my nickname. So you mean you gave them your nickname, and then it became a big issue because everybody was pointing fingers at you made this mistake, you made this mistake. So what did we do? At the end of the day, we decided that every patient that comes in has to show us an ID. Give us an ID. It was a policy that was incorporated into our list, into our SOPs for sample collection, for communication with patients. Show us your ID cards so that we can transfer you the name on your ID card into your forms. And then he improved the errors. There was minimal those errors of name processes. Of course, the elderly people might not have names. We will tell them, oh, Pants, can you just show us any picture on your phone that has your name? And then there was like changing and rechanging until we're able to prevent those errors from reoccurring. So if they did not report that situation, you wouldn't know that they're having that problem. So again, if there was a criticism in the organization about errors, they won't feel comfortable to come and tell me that, oh, we're having these problems. How can we solve this problem? So definitely open your hands, welcome, tell people you can make errors, be firm. Please, I'm not saying don't be firm. I'm not saying welcome and embrace errors. Be firm, but then allow people to know that I'm approachable. You can tell me. We will find a solution. The whole point of me being here is to be a solution provider. So what I talk about root cause analysis. So when we talk about root cause analysis, RCA, this is one of my favorites. So basically, we're asking a question: is a problem-solving technique that helps you to answer the root causes of an adverse event. So if you look at the tree, so usually, for instance, we would say, why did this error happen? And we would just say, oh, something failed, the reagent failed. Why did the reagent fail? What exactly happened? What happened down? We're not just asking, did the reagent, we don't want your problem statement. We want to know why did the problem happen and how can we solve the problem. So the root cause analysis helps you identify the problem. It helps you resolve the problem. It helps you eliminate patching. So it's not, this person made an error today, so I should do it better. That's patchwork. You're patching the problem. You're not solving any problem. And then you can conserve resources. You can facilitate discussion. Quite recently, I was in a seminar and they said that the whole point of brainstorming is for quantity, not quality. And I was like, what do you mean? So you mean brainstorming is not for quality, but quantity? So when you're brainstorming with people, the lady, it was a business meeting, and she said, don't cut anybody short. Even if they've repeated the same thing 2 times, they've told you, they've emphasized, maybe somebody, sometimes you're in a meeting and somebody says one thing, and then another person repeats the same thing, and then the third time, don't cut them short, because the more the person is repeating it, somebody else is like, it's true. How can we even solve that? So the whole point of brainstorming, which is also a part of root cause analysis, is not to get quality, is to get quantity. Let everybody keep bringing their ideas. Then we will weigh down which one is the best idea out of what everybody, based off of advantage and disadvantage, how much impact it would make. And then you provide rationale for strategy selection. So after you've done your brainstorming for the problem, and then you're like, why did we choose this one? Why is this particular solution the problem? Why is strategy the one we selected? It has to have an advantage and disadvantage, and the advantage has to outweigh the disadvantage of whatever strategy you have. So another example, I would appreciate if you put your answers in the comments, in the chat box rather. So you have an example here. Tissue slide was mislabeled in the lab, which led to erroneous result reported to the physician. Error was caught before the patient notified. Now, this is a problem statement. Can we do a root cause analysis based off of what we've explained? Now, we are asking ourselves, why did it happen? Now, what are the simple, when we're asking ourselves why did it happen, we're looking at our processes. So does it mean that, for example, they were not labeling the slide boxes before the tissues were being cut? Does it mean that the physician was not informed that this error was going in? So what are your thoughts about root cause analysis? You can, based off of this error, and we can always take some answers in the chat box. So another thing is continuing education. Please, we cannot overemphasize it. I believe in the more you learn, the more confident you sound. If you don't know it, you tend to not want to, when they ask, Nifemi, what's the answer? Or Abigail, what's the answer to this question? You immediately don't. My language is like, I'm looking at the laptop because I don't want them to call my name. Know it. There's a sense of, oh, okay, I can contribute on this table. I can say this, I can say this. So it does, continuing education does, it reduces risk. There's a risk reduction and there's an error prevention, because the more you know, the less error you make. And then enhanced communication and collaboration. We cannot overemphasize it. You know it when your doctor colleague comes. You tell them that, oh my God, you mean the patient had uremia? These are some of the causes. In fact, I have seen this case when I was. So there's more confidence when you know what you are speaking about. And then, of course, promotion of evidence-based practice. You can't just tell us you are doing this method. Why are you doing this method? Why are you doing this test? That's the important continuation. Another element is process improvement. So continuous monitoring and feedback loops. So are we repeating the same mistake? Now we talk about root cause analysis that we spoke about. Root cause analysis is of work. So every time you're thinking about this mistake that was made, how do we prevent it? What strategy? Are we repeating the same mistake? Because if you're repeating the same mistake, that means your process is not effective. So there's a culture of safety and continuous learning. So you come and there's like a problem. Everybody feels safe to say, this is what the problem is. This is what we cannot do. And then there's standardization and streamlining of processes. Now, when we talk about environments, there was something I developed while I was also in the laboratory. I posted my number on the gates and in front of the building. And I told them, if you have any complaint about our services, please call this number. And up until today, I still get calls that people call and they're like, oh, I called you the other 2 years ago, which was the last time I was in the lab, over 2 years ago. And then they're like, oh, I got your number then and I called you. Now I have a problem today. And I'm like, oh my God, I left the organization over 3 years ago. And I have to be like, okay, but since I left, I still know people that are still there, and I would patch you up with people that are there. So definitely, that's because you've given them room to tell you, oh, this is what's happening. It's not working. I don't feel safe as a patient here. We also raised questionnaires that we asked the patient, how was our services? How were you communicated to? Did you find the environment okay? Was it easy for you to find your way around? Because I know part of the QA, you have to put signages that tells people where to go and where next to go, and when there's a slippery floor. So these are questionnaires that we put. And I know I've been speaking about patients, but there's a staffing and workforce dynamic. If I am a staff in your place and I don't feel comfortable in that place, I don't understand how we are going to improve patient safety. I don't feel safe. How is the patient going to feel safe? So I know you would say, why are you telling us we are young professionals? But we are young professionals that grow into old professionals. And it's important to not go with the status quo. Don't feel like, oh, in this our profession, there's nothing happening, or people say that I get that a lot in our profession, there's nothing happening. I can put it to you that with your degree, with your profession, there's a lot happening. You probably will not know because of where you are right now, but the more you grow, there's a lot happening. There's a lot of changes you can make. There are a lot of tables you can sit down on. Don't let anybody give you the stifling mindset that, oh, this is our profession, it's not this, it's not that. So when you see problems happening, when you see things that are not the normal, you are okay with it because it's our profession. That's how they've been doing it. You are the change makers. You are coming up. You are young. You need to know what's the difference between right and wrong. You need to be able to question and say, this doesn't work for me. This doesn't work with my practices. This doesn't work with who I am. I'm Aina. This doesn't work with how it doesn't feel good. I don't want to work that way. So these are conversations you have. And more so, you can't have those conversations without data. That's the one thing I love so much. So when they come and they're like, oh, how many patients have you done? How many CV have you done? Maybe you want to tell them that, oh, we need to increase funding in this aspect. And then they're like, why do you want to increase funding in this aspect? It's data. We had over 1,000 patients that did this. So that means that's one of our strong suits. We have how many patients that complain that the toilet is not okay. That means that's our strong suit. And trust me, if I am a patient and the toilet is not okay, you will not see me coming back there. If I'm a patient and one of your staff is rude to me, I would not go back there. There are too many factors there that you ask. There are too many factors that you raise a questionnaire. You can go back to your facility and you raise a questionnaire. If you're privileged to work in some facility and you can speak to your managers, you tell your manager that I want to raise a questionnaire. I want to see how people perceive our services. I want to see what people actually think about our services, and I want to know. Another important question: will you recommend us? If you come and you've experienced us, will you tell you? Because trust me, word of mouth can destroy a business and can make it. It's word of mouth spreads faster than the TV ad we have. So somebody goes and say like, oh, I went to that hospital today and this lady was so helpful. They were so helpful. The next person thinks about it like, oh, I want to go to a hospital. And then they remember that, oh, my friend told me that that hospital, they were very good. So ask these questionnaires, raise these questionnaires and ask them, did you enjoy our services? What can we do better? Will you recommend us? What would you do? How would we serve you? How would your safety be prioritized in our facility? So take up a point and then do that. Honestly, you might not be in that facility for a long time. You might leave at any point in time. But you know what people will remember? They're like, oh my God, when Nifemi was here, when Sultan was here, that guy, he did something. At that point in time, they might not tell you are doing something good. But guess what? A few years down the line or a month down the line, when the next intern comes, they start saying, Eyina did well when she was here. You become a yardstick of what a good intern should do. So leave whatever you feel is happening in the profession, whatever you feel your environment, however your environment is limiting you. Your environment can limit you right now. It might not limit you next year. So you are going into every room with integrity. You are going into every room as a professional. I know what I am doing. I know what I'm coming here to do. So in conclusion, without all these elements, healthcare errors will increase and then patient safety decreases. So please, I want to urge you as young professionals, step into wherever you be, at least where you can. Thank you very much. Thank you. I'm going to stop sharing my screen now and hand over the mic.
Thank you. Thank you very much, Eina. It has been a wonderful session. I can see that people are clapping already. Yes, yes, yes. Thank you so much. We've
I think
really
I'm losing you,
gotten
Victoria.
value this night and we are grateful. We are grateful. Thank you so much for sharing all of this. Um, so we'll be going, yeah, thank
Okay.
you. We will be going on to the next speaker. We'll be going to the next speaker right now. All right, so our next speaker for tonight is ready for us. Is also ready for us, and I'm sure we are ready for the second speaker. And then we'll be inviting Dr. Aliu Israel to speak with us on quality management system in biomedical science. Quality management system in biomedical science. Are you excited? Are you ready to receive our speaker? So I'll be reading a brief introduction about Dr. Aliyu Israel. Dr. Aliyu Israel is a healthcare management and quality management system QMS consultant with over 14 years experience in healthcare delivery, healthcare program management, public health, clinical research and trials, implementation of programs, monitoring and evaluation, sales and marketing, healthcare logistics and procurement, general operations with a career path in healthcare management, quality management system, and public health. He is a trained healthcare manager and quality management system specialist according to ISO 15189, ISO 17025, and ISO 9001 quality requirements. He has consulted for Global Fund projects, different national survey projects, researches, mentored different laboratories to international and national accreditation, audited several laboratories across over 25 states in Nigeria, trained professionals on QMS across UK, Ireland, Australia, USA, and several African countries, highly experienced in setting up molecular laboratory, high-profile labs, design of LIMS to suit organization purpose and work. He has provided support to some organizations from United States of America, Germany, South Africa, India, China, Turkey, and Nigeria for molecular diagnostic product assay, genetic testing, and PCR, laboratory software, and disease surveillance. So tonight, Dr. Ali Israel would be taking us on another wonderful voyage. Are we showing our excitement? He'll be taking us on another wonderful voyage on quality management system in biomedical science. You're welcome, sir.
Yeah, hello, good evening,
Good
everyone.
evening, sir.
It's nice to hear me. Well done. Uh, okay, let me see and try if I can share my screen. I think.
All right, sir.
Can you see my screen? Hello?
No, sir.
Okay. Uh, Let me see if I can work using my laptop to get it done. Just give me some few minutes, please.
All right, sir.
Okay, why I said hello, can you hear me?
Yes, we can hear you, sir.
Okay, so I think I'll just be speaking while I share my screen so that we can save some time.
Okay, sir.
Okay. So good evening, everyone. How has been our day? How has been the program? Uh, Thank you for having me, for inviting me into this conference program, and I want to especially thank the organizers for the opportunity and wish the whole system all the very best as we move ahead and as we work together. So my topic today is quality management system in biomedical science. So can you all hear me loud and clear? Hello, can you all
Yes,
hear
sir. We
me?
can hear you clearly. We can hear you clearly, sir.
Okay. So we're looking at yeah. So we'll be looking at quality management system in biomedical science. So there are two major um course of discussion here. Two things that tie this topic together. First is quality management system, and second is biomedical science. So biomedical science is a profession. Quality management system is also a profession. So we are trying to merge a profession in a profession, or trying to merge a practice in a practice. So quality management system is a practice. Biomedical science is also a practice. So we must have that understanding that this is so the objective of this presentation is to introduce participants to quality management system in general, in generic, because quality management system is broad, is big, is large. So we're going to be doing just a bit of those introduction tonight. And then also we're going to be looking at how we can be able to integrate quality management system into biomedical science and how it becomes relevant to the practice. Next, we also understand the basic concept of quality management system. So that will be the three main objectives tonight that we are going to be actually looking at. And so by way of introduction, my name is Dr. Ali Israel. I'm a healthcare and a management system consultant with Pegasus Consultancy, Pegasus Limited. And I do a lot of things around the healthcare system, healthcare strengthening, trainings, coaching, and a whole lot. And by the grace of God, when it comes to quality management system, we have had students from every continent of this world that have attended our programs and which we have coached and mentored to profitability and to where they are. And it's also interesting to know that even in Nigeria, that we have done training, coaching programs for more than 7,000 healthcare professionals, both medical lab scientists, med lab technicians, nurses, pathologists, and the rest. Because quality in healthcare system is a big deal, and it's something that we all need to understand. As I used to say earlier that if you don't understand quality system, quality management system, and you're a medical science or in biomedical science, you are simply a quack. You are simply a techo, if you know what is called techo. So what makes you relevant? What gives us the edge? What gives us that cutting edge to be able to produce a quality result that is accurate, reliable, and timely is quality management system, and that is the fulcrum of biomedical science practice. It is what it is the fulcrum of biomedical science. Next tomorrow on Monday, we're having a program in MedLab West Africa. One of the things we'll be speaking on is on there's what we call the Laboratory Quality Management System Conference. So you can take time, register for that program, also be a part of it because it's something you need to keep hearing, keep knowing, and keep doing for you to be able to find relevance in it, in what you are doing. This is what makes the practice standardized. This is best and international price. So by way of introduction, what is quality management system in general? I'm still trying to look for send for my link so that I can be able to share my screen for us to do. But can you all hear me loud and clear?
I hear you. We can hear you clearly, sir.
Okay.
Yes, sir.
Okay, I just want to be sure that you can hear me so that we can be able to. Okay. I think putting the link here. Okay. That's a little bit. So can you hear me? So I'm logging to the
Yes,
other
sir.
system. Can you hear me?
Yes, sir. We can hear you, sir.
I can hear you, sir. I can hear you, sir. Can continue, sir.
So can you see my screen? Hello?
No, sir, we can't see your screen, sir.
No, sir, we can't see your screen now.
Okay.
No, sir, we can't see anything.
Can you see now?
No, we can't see anything.
No, sir.
Still not seeing anything.
Okay, just hold on. No, no. But it's showing here that I can see my screen now.
Okay, let's share it to meet.
Yeah. Stop sharing.
Share the screen. There is a yeah. Now it's been highlighted.
We can see it,
Can you
sir.
see it?
Yes, sir.
Yes, sir.
You can see it.
Yes, sir.
You can see it now.
Okay.
Yes, we can see it now, sir.
Okay. Yeah, so I was saying by way of introduction, generally a quality management system is a collection of business process um, that is focused on consistently meeting requirements and enhancing their satisfaction. That is customers' requirements. Now, the customer is generic. The word customer here is generic. And in other words, it could be your patient for biomedical science, it could be your doctors, it could be everyone who patronize the biomedical services. So generally, quality management system is a collection. When you say collection, that means a group of business process system that is focused on consistently, you must underline that word, consistently meeting the customer's requirement and enhancing their satisfaction. So it helps to align the organization purpose with strategic direction. This is according to the ISO 9001 2015 definition that a quality management system is a collection of business process that is focused on consistently meeting the customer's requirements and enhancing their satisfaction. Now, it is also what aligns an organization purpose and strategic direction. Now, for the total quality management system, which is part of a quality management system, it is a systemic participatory approach to planning and implementing a quality management system for other organization or for a program. Now, majorly TQM, which is total quality management system, which is also a part of quality management system or a system which you can use to implement a quality management system, focuses on process improvement. Majorly, it helps to meet and exceed both your client and your patient needs and help you to identify problems and help you to fix those problems. So TQM is a management tool that helps to implement quality management system in any given organization or in any given process or in any given project. Is that well understood? Hello?
Yes,
Can you
sir.
all hear me?
Yes, sir. Yes, sir.
Yes, okay. Okay, yes, thank you. So by way of definition, when we talk about quality system, we talk about a quality system refers to the organization resources, process, and procedure to implement a quality management. Now, which borders more than quality assurance and quality control. So a quality system is that resources, is that process, is that procedure that helps us to implement what quality assurance and quality control on every other quality system. So in other words, a quality control is part of a quality assurance program. And the quality assurance program all form what is given to the quality system. Don't worry, you may not understand, you may understand, but as we go on, you get to understand what I'm talking about majorly. Now, every aspect of the healthcare system plays a vital role in the quality of healthcare. So we must understand that for we to be able to exhibit quality, we must have skilled and trained personnel, which is critical to delivering the quality result, both in terms of the management skills and what the technical skills. So there are two major skills when it comes to biomedical science that we must all understand and we must all focus on, we must know. One of it is what the managerial skill, which has to do with management skill. The other has to do with technical skill. Am I communicating? Am I communicating?
Yes, sir.
Yes, sir.
Okay. So now when we talk about the quality management system, for the purpose of tonight, we're going to talk about the principles and the essentials. Now, these two things are major factors. Are you getting when it comes to biomedical science? There are two major things that drives the biomedical science. Now, because in the practice of biomedical science, I won't want to spend time tonight dealing on biomedical science. We all know what biomedical science is, and most of us are biomedical scientists or biomedical science students as it is, either to orientate with a lot profession that has to do with health towards healthcare delivery, diagnosis, monitoring, and ensuring that accurate diagnosis are being done and the rest. So, but let's look at quality in biomedical science. So, when we talk about quality, two major aspects are key. When we talk about the principle and talk about the system. Now, when we talk about the principle are 8 in numbers. Majorly, why the system, quality system essentials is 12. Now, for number 1, we talk about customer focus. Hello, can you hear me?
Yes,
Yes,
we
sir.
can hear you, sir.
Yes, sir.
Okay. So the first one has to do with customer focus. Second, leadership. Third, involvement of people. Fourth, process approach. Fifth, system approach to management. Sixth, continuous improvement. 7, factual approach to decision making. 8, mutual benefit.
All right, everyone, please be calm. Dr. Israel will join us soon.
Hello? Hello?
We can hear you, sir. Good evening, sir.
Okay, yeah, sorry, I think network. So I will just explain. Then later I will share the slide with us so that we can be able to manage the network. So well, before I know I talked about the two aspects that has to do with the quality system, the principles and the essentials. The principles and the essentials. But before I take us through the principles and the essentials, I want to just actually give you a brief introduction or history of quality management system. How did quality management system came into biomedical science, and why quality management system? Now, can you all hear me loud and clear? If you can hear me, you can say yes, so that I just
Yes,
can
we
type
can
and
hear
say
you.
yes.
Yes, yes, we can
Yeah.
hear you.
Okay. Yes. So the brief history now, brief history of quality management system and laboratory quality management system. Now, this history of quality management system can be
Yes,
traced
I can.
all the way back to the Middle Age. Please listen to me carefully. Now, during the Middle Age, work completed by journeymen and apprentices were evaluated and inspected by skilled workers. So, in the other industry like manufacturing industry, when people do work, all those middlemen, all those apprentices, at the end of the day, the skilled workers will ensure that there is a quality standard that the final product is being made. So before the buyer comes to buy it, they will ensure that those skilled workers will ensure that this product is meeting the best need. So while the history of quality management system has gone through a number of changes since that time, the end goal is still the same. That to ensure that the final product or the final services is being good enough for the consumer. So during the 1920, the quality management system, as we know today, began to surface. While the focus on quality management system was still on the end product, it was the first time in 1920 that we talk about statistical theory, which was applied to the product of the quality control. Now, listen to what I'm trying to say. Now, when we talk about product of quality control, this was determined through inspection. So this involved now measuring, testing the product, the process, and the service against a requirement to ensure that each element adhere to a standard and guideline. If you have ever worked in a factory, I've been privileged to work in a factory where they produce this cover bottle. If you know, there's where you do all this Coca-Cola, where they produce it and the rest. Now you see that there's what they call raw materials. There's what they call the process, different process, and then so what quality was doing at that particular time. Now you remember the first time they were just busy about the end product. Now they began to check each phases, the quality of the input that determine the quality of the output. So they were monitoring both every aspect of the quality to ensure that the final output comes out well. Now, the algorithm worked for a while. This algorithm worked for a while over a time. Now, business began to grow and expand, and more products were being manufactured through the day. Now, companies started to experience difficulty in following through the quality control standard, and it became evident that there is need to be a change and a development to ensure that what the quality is actually met. Am I communicating? So in 1940, the industry leaders then, people like Deming, Dodge, Juran, and Romin, came about the concept of total quality management system as we all know today. So it was that during that 1914, then the Japan caught the wind of total quality management system. Then at that time, Japan product used to be known as considered as poor product or imitation. So after hearing the success of quality management system in the Western world, Japan employed the assistance of these management experts like Demi and Juran. Little did they know that the Western culture known at that time that Japan would soon push and envelop into a new standard that is being known as the total quality management system. So it was during the 1969 conference, International Quality Management System Conference, that the first word total quality management system was used by Feng Baron. Sorry to use many language, but I just need you to understand some of all these things. Then these things now began to creep into other aspects of the system. Now it was in that 1940 that the healthcare started developing some of this interest into it, and from 1960, 1970, other sector apart from the manufacturer, and also that this system is actually good to produce good and quality services. Then the healthcare also bought into it, and that's how quality management system came into healthcare and also into biomedical service. Is that well understood? Please read about W. Edwin Deming, read about Philip Crosby. You will see it on, maybe you see it on, then Joseph Juran, Edward Deming, Philip Crosby, and Joseph Juran. These are key fathers of quality management system. Now, Can you all hear me loud and clear?
Yes, we can hear you. We can hear you.
Yes. So remember I said that the quality management system, we have both the principle and we have both what the essentials. Two of us. Hello, two of us. Can you hear me? So yes. So
True,
now
true.
let's look at these principles in brief. Now, please listen. The QMS principle is derived from the ISO 9001 2015. Now, this principle is a foundation of the ISO portfolio because we have many standards of the ISO. Now, the one that is specific to the to the biomedical science or medical laboratories, ISO 15189, and the latest version is 2022 version. The one that was previously being used was 2012 version. So this, you have a lot of portfolio of ISO. ISO means International Organization for Standardization. International Organization for Standardization, not International Standard Organization. It's a French word, so that's why it is like that. International Organization for Standardization. So these principles are the basis of good laboratory practice, GLP, and GCLP, good clinical practices, and good manufacturing practice, GMP. So these are the basis for this principle. What does number one principle say? Customer focus. Please write it down. Customer focus. I will state it and you just explain. It's on the slide, customer focus, but the explanation is not there because I won't put them in the explanation. That's why you have to be attentive. That's why you have to be here. Because even though you go through the slide, if you don't listen to what I have to say, you can't get it. The principles are stated there, but the explanation is inside my stomach. And that is why we are here. Am I communicating? So one is customer service. So this principle deals with the organization, the lab, the profession, establishing a customer focus by understanding the need of their customers, meeting their customers' current and future need and expectation. He said for the business, for the profession, for their services to be able to succeed, they must be customer focused, they must be patient focused, they must be their end user focused. So this with the organization establish a customer focus by understanding the need. Remember, let's say, for example, now during the time of COVID, if any lab that does not have COVID services was almost irrelevant to the community. So you must keep understanding the need of your customer. You meet the need and exceed the need, the expectation. That is how you can continue to be in professional excellence. I mean, first remember the story of Nokia. Nokia used to be one of the best phones, and they ended. There was a time the management called and they stopped their research and development department. They stopped funding it, and that's how iPhones and other people went ahead, created products that consistently meet the future needs of their customers, and that's how Nokia became a forgotten story. So customer focus is one. Number two, leadership. Write it down, leadership. So when we talk about leadership, organization will succeed when the leaders establish and maintain an internal environment that is full of achieving the organization common and unified goals. They must provide leadership for you to be able to excel. So in biomedical and profession, in the lab, wherever you find yourself, there must be leadership that is being provided. Next, talk about involving people. It said that the organization will succeed by retaining competent employees, encouraging continuous enhancement of their knowledge and skill, empowering them, encouraging engagement, and recognizing achievement. So for any lab, for any organization, for the biomedical science profession to succeed, you must retain competent employees. You must encourage them, continuous growth, enhance their skill, empower them, and engage them and recognize achievement. Next, it talks about process approach. So when we talk about process approach, it talks about the process has to be unified. The process has to be tied together. Let's say, for example, if you go to McDonald's in South Africa, you eat a burger in McDonald's South Africa. If you go to UK, you eat burger from McDonald's. They have the same recipe. They have the same taste. That is process approach. Next, system approach. An organization with sustain system when the process are managed as one coherent quality management system. So let's say, for example, now if you have a lab that has 5 branches, you must have that same quality. They must operate on that same coherent quality management system. Number 6 talks about continuous improvement. An organization will maintain a level of success or performance when they identify, create, and explore new opportunities where they are established and sustain an ongoing focus of improvement. So at every point in time, the profession has to improve, the department has to improve, the services has to keep improving. There must be a continuous improvement project, and that's one of my selling points, and that's one of my areas of strength in quality management system, process improvement. I can't work in any other lab, I can't work in any organization and leave them the same way, even though it is 6 months, even though it is only 3 months, even though it is 1 month. There must be a step ahead of where they are, because change is the only thing that is constant. So that is continuous improvement. Even when you have an accreditation, so there must be rooms for improvement. You must keep improving. That is the only way you don't get out of professionalism. Now, I want us to understand that professionalism is not a function of professional course. You may study professional course, that does not make you a professional. A professional is one who is able to exhibit quality, exhibit excellence, and deliver what is expected. So I can be a medical doctor, I can be a medical lab scientist. If I'm doing quack, I'm not a professional. You call it quack. But I can be a shoemaker or shoemaker. If I can do shoe well and do it, this guy is a professional shoemaker. Why? Because he's able to put in excellence, he's able to put in quality, he's able to put in the best of it. Am I communicating? Hello?
Yes, sir, you're communicating,
Yes, sir.
sir.
We can hear you,
Yes.
sir.
So the
Yes,
last,
sir.
the seventh one. Yes. The
We
seventh one
can
has
hear
to do
you,
with
sir. We can
factual
hear you.
approach to decision making. So for the factual approach to decision making is that the principle of finding that the organization will succeed when they have established an evidence-based decision making process. This entails gathering input data before and checking the cause and effect. In other words, before the decisions are being made, there must be data, there must be facts that shows what this decision is the right decision. Then we'll talk about the last one, mutual beneficial supplier relationship. I won't want to go into detail because maybe some of us are not into much of the part, but just to give you a feel of understanding of what it is.
Hello, we can't hear you again.
Sir, we can't hear you, sir.
Sir, we cannot hear you.
Sir, we cannot hear you.
Hello, we can't hear you.
Please let us be patient. His network is fluctuating, please.
Okay.
It's not for it's fluctuating.
Okay, yes. So those are the 8 principles. Now, then when we talk about the essentials, we talk about uh, the following: organization. Please take note. Personnel. You will see it on my slide. Equipment, purchase and inventory, process control, information management, document and record, occurrence management, assessment, process improvement, and customer service, facility and safety. I will take that again. Number one, you will see it on the slide. Number one, we'll talk about organization. Number two, personnel. Number three, equipment. Number four, purchase and inventory. Number five, process control. Number six, information management. Number seven, document and record. Number eight, occurrence management. Number nine, assessment. Number 10, process improvement. Number 10, customer service. Number 11, customer service. Number 12, facility and safety. These are the 12 quality system essentials. You can read them up, you can also check them up, but I just want to explain some few things to us when it comes to quality management system. So now listen, why when we talk about quality, we talk about the ability for the biomedical science profession to deliver accurate, reliable, and timely results. Now, when we say result is accurate, that if you give a particular result, that result must be the correct result or close to the best correct result. That's an accurate result. It has to be precise, it has to be accurate. Next is reliability. So if you take that result to anywhere under that same condition, that same sample, that result you should be able to reproduce. You should be able to reproduce it. Am I communicating?
Yes, sir. Yes, sir.
Hello?
Yes, sir.
Yes, we can hear you, sir.
Okay. So that is it. Now, the process of the lab of biomedical science, the non-process, is divided into three aspects. We have the pre-analytical, analytical, and the post-analytical. Please write it down. Pre-analytical, analytical, and the post-analytical. We also call it pre-examination, examination, and post-examination process. So let's say, for example, before the sample is collected, book recording, keeping, sample collection, spinning of the sample, all those falls under the pre-analytical. Now, analytical has to do with collection of the sample, no, with quality control, let's say quality control testing and the rest. Then pre-analytical has to do with post-analytical has to do with record keeping, reporting, delivering of result. All this system has to work concurrently. If there's a breakdown in any aspect of this process, it will lead to a poor result. Now, let me ask you, of what good is a result that is not accurate? Now, of what good is a result that is generating from a lab that let's say, for example, now someone wants to go for surgery and they say they needed electrolyte urine creatinine result and in the next 2 hours. I say, okay, because you are trying to make the result good, now say, okay, at the end of the day, you bring the result in 24 hours. Or when the patient is dead, that result becomes what? A mere paper, a mere information. Why? Because it's not time, it does not meet with the timing. But if you go to some private, they will even tell you that you should refund the money that the patient is dead. Because why? It does not actually meet the need. Now, let me ask you one question. If you were to enter, most of us have flight, maybe plane, and if somebody is to tell you that a particular airline has 99% chance of landing, will you patronize that airline company?
No, I won't.
Why will you not? 99%, is it not good enough?
Okay, I thought you
Sir,
said
please, can you come
9%.
again with the question?
Okay. If you are to patronize an airline company, let's say airline, and they tell you that they have 99% chance of landing, that means 1% error. 99% chance of success is 1%
Yes,
error.
yes, I'll
So
Okay,
will
patronize.
you,
definitely I will patronize them.
Definitely.
yeah, will you patronize that airline?
Yes.
So I won't patronize.
Yes, sir.
Okay. Now let me explain to you what 99% chance of landing means. It means that every 100 plane they fly, there's a probability that one will crash or one will not
Exactly.
land. That's what 99% success means. So that means to every 100 plane, there's probability that one is going to go off. One is going to go. Will you enter that plane? You will not now, because you don't know which of the one whether you're going to enter that one. That is going to so that is what. So
Definitely.
quality has to be absolute when it comes to biomedical science. Why? Because we deal with life. So there are no rooms for error. Are you getting me? There are no rooms for what? Hello?
There is no
There
room
are
for
no
error.
yes. There are no rooms for error, because that error may happen to your father, could be your mother, could be your sister, could be you yourself. So imagine if they say that the plane had a 99% chance of landing. So that means, so every 100 plane they fly, one of the planes can crash. I won't enter that plane because you don't know which of the one you are going to fall into. So that's how quality is in biomedical science. It has to be 100%. You have to achieve quality, and there is no room for error, because that error can be anybody. It can be your father, can be your mother in the theater, can be anybody. Am I communicating?
Yes, sir, you're
Yes,
Yes,
sir.
sir.
communicating. Mhm.
Now, when you implement a quality management system, that does not guarantee an error-free process. It only means that when the error happens, that error can be detected and prevented. So the fact that you operate a quality system does not mean there will not be error in the system, but it means that that error can be detected and that error can actually be prevented. Am I communicating?
Yes,
Yes,
sir.
sir.
Yeah,
Yes,
you
sir.
are, sir.
Yes. So, what are some of the requirements? So, what are some of the requirements when we want to implement a quality system in biomedical science? Then you must have all these essentials in place. Personnel requirement must be there, organizational requirement must be there, the equipment requirement must be there, all the technical requirements must be there, and every other aspect has to be fully covered. You know what I mean? So achieving the 99% level of quality means accepting 1% error rate. Imagine an aircraft company tells you that they have 99% chance of landing. Will you patronize such an airline? No. As it is. I have some pictures that denote that. So we must understand that we are in a profession that has to do with you being careful. Not just being careful, you have to give your ultimate best. If I'm in mechanic workshop now and I spoil a car, I can buy the car. But if you give a first result, you give a first stuff to a patient, it could cause a whole lot of damage. Most of the damage can be irrecoverable. Let's say, for example, someone comes in and a pre is doing what do they call it now? Pre Pre-transfusion test. Pre-transfusion test that is such a way that before the patient is being transfused, some analysis has to be done, and you now end up throwing up that sample or misplacing that sample. What does that mean? That and the transfusion has gone, you can never get that result back. Imagine if an operation is done, and let's say a woman's breast is removed, and you have to do an histological test on the cause, whether it's a cancer or not. At the end of the day, you misplace the breast tissue. You are going to be sued. Why? Because you cannot have a spare breast.
Yeah, that's true. That's true.
Are you getting? So there are mistakes that you can't just do. Why? Because that tissue is just only one in the body. It's not like blood that's okay. I will go and collect another blood. Let's say, for example now, somebody's intestine was removed, and maybe they are trying to find the cause of such a thing. At the end of the day, you went to do rubbish, and maybe you mistake the sample or something. You cannot get those things back. So you have to ensure that that's why when people work within the field, I tell them that you have challenges, please leave your challenges at home. When you are coming into the space, come with the whole of your mind, so spirit and body, to ensure that you're able to do this. Now, as I try to conclude, because my time is almost up. What are the benefits of implementing quality system in biomedical science? What are the benefits? I'll just run through them as I try to round off this. Mhm. Hello?
Yeah, we see, sir. We are with
I
you.
agree with you,
Yes.
sir.
Okay. Quickly. Now, what are the benefits of quality management system in biomedical science? It provides quality result that is accurate, reliable, and timely. Now, three key things determine the quality of any result: the accuracy, the reliability, and the timeliness. So everything we are doing within the workspace. So let me tell you why, how how complicated and how highly expertise that is needed in biomedical field. Now, if I am in a theater as a surgeon, are you getting me? And I'm taking a procedure, let's say maximum 2 or 3 surgeons, highest, we can handle a process. One surgeon can handle a particular process from beginning to the end with an assistant of maybe on a theater nurse and the rest. But when it comes to the laboratory, the biomedical science, the minimum people that successfully attend to one sample could be as much as 4 persons. One person may collect, one person will spin, one person will do the analysis, one person will validate it, one person will verify it. So it is a chain of process, like a factory setting. So every aspect, from the pre-analytical to the analytical to the post-analytical, has to be on point. If you drop the ball at any point in time, definitely the ball is dropped. So it helps us to provide quality result that is accurate, reliable, and timely. It helps us to build a system that can meet and exceed the patient's needs and the client needs. It could be the doctors, it could be those who patronize your service, it could be the research and other. It helps to improve client and patient satisfaction. It helps to higher productivity. It helps to eliminate defects and waste. It helps to reduce the cost of patient management. Wrong diagnosis can make a patient to do multiple test, multiple examination. How many of us have read about false positive result and false negative result? Now, when you talk
Yes,
about false
yes,
positive
I've
result
heard
and false negative result, now, if I say between a false positive result and a false negative result, which one do you think is more dangerous?
a false
False
negative
positive
result.
result.
Why?
Negative result.
So if you are talking, you are speaking, speak. If we say false positive result, why do you think false positive result is more dangerous?
Okay, I think false negative result is more
False
dangerous
positive result.
Okay. So,
because
mm,
because the patients will be wrongly diagnosed, whereas the disease or whatever he's suffering on is still affecting he or she. So definitely, before the right diagnosis to be done, it might have become chronic, something like that.
okay.
Okay, for me, I feel is false positive result as more dangerous than false negative result.
So why do you think so?
Okay, okay, let's take the issue of a patient running a serological test and the patient doesn't have HIV, so to say, but if the test is being done without proper management, without following proper procedures and the rest, and the test comes out positive instead of negative, it's to the detriment of the patient, and that kills the patient faster than any other thing.
Okay. Okay. So both of
For
them are
me, I
detrimental.
feel
Hello, please.
false positive.
Okay. Hello,
I
please.
feel
Let me
false
just
positive
conclude.
is more.
Hello, let me just conclude because of my time. Please. I will need to sign out as much as possible. Okay. Now, both false positive result and false negative result are errors. Now, false positive means that the person does not have the disease. You now say the person has the disease. Now, if you say the person does not have a disease and you now say he has a disease, so the person will go for further testing and treatment. But when you now say the person had, then false negative is that the person actually had the disease and you are telling the person does not have the disease. So what it means that the person will feel relaxed and because why that disease will be eating him up. So false negative is actually more dangerous than false positive because false positive, let's say for example, somebody do it, they can say, okay, go for a confirmatory test and later discover that the person did not actually, or they start treatment and discover that later it was fine. But false negative is like telling somebody who is dying and saying nothing is wrong with the person. And maybe if the person has not started showing symptoms, person may feel, oh, everything is fine. At the end of the day, that sickness comes up and eats up more about the person. So they are all defect. Now it helps to reduce the cost and maximize profit. It helps to in healthcare strengthening. It helps to meet regulatory and accreditation requirements, quality management system. It helps to enhance organization image and the marketing activities. It helps for continuous improvement. It helps to also attract investment into the profession and the rest. So these and many more are something that we must all embrace. So it is a welcome development that every one of you here, if you want to really succeed in biomedical science, quality management system has to be there. So quality management system is so deep that it connects every aspect of the profession. Whether you are a medical doctor, whether you are a medical lab scientist, whether you are a nurses, quality is the key. And that is the center of the message tonight. That we must keep imbibing it, we must speak it. As at 2018, when we started consultants in quality management system, we had a lot of people who didn't even know the definition of ISO. We have, if you go to South Africa, we have over 300 to 400 labs that are ISO 1519 accredited. But when it comes to Nigeria, we just have like 15 or 20, less than 15 to 20. So this calls for a lot of things. You see, how many of our teaching hospitals today go to microbiome that has quality control aspect when it comes to do a lot of things. People give false results, people give results that are not even accurate. They no quality control, a lot of things. You go to here, they tell you have 1+, you go to here, they say no plus. Every day you go to there, they tell you 1+. Even you're just finishing malaria test, you're getting 1+. So a lot of all these things are things that we need to understand that to save the image and to give the organization a corporate to give the organization the corporate blessing that we need. And even for yourself, you cannot understand quality management system and lack job. You cannot understand quality management system and not be sorted and not be sorted out for. But that is just the truth. In my 12 to 14 years of quality practice, I've never been out of job for any time. Why? Because at every point in time, wherever I go, I find myself being relevant. This key. So it makes you, so if you want to be really relevant in this profession, you want to be relevant in the healthcare space where the quality management system is one skill that you must imbibe. It's one thing you must keep developing yourself. And as you expand to other aspects of the profession is so blessed, the profession is so diversified. But yeah, some of us are the most undiversified among us. So it goes beyond bench work, it goes beyond the hospital, it goes beyond the business is there, products is there, equipment is there, a lot of things you can do. So I wish you all the best. Um, your the organizers will drop my number, my email, and I will share the slide with you. If you have any further questions, you could also reach me. I'm actually on the transit, but I just have to take time to just do this class for us tonight. So do have a wonderful night rest. If you have any questions, please, you can reach me with your question.
Oh, thank you so much, sir. Thank you, sir. We are so blessed to have you, sir. And it has been an enlightening session. Uh, quality management in biomedical science. It has been a very great session, and we are really grateful. Thank you so much, sir. And my take-home point for tonight is that if you're a biomedical scientist and you don't know code and you don't know QMS, you are practicing quackery. Yeah. So thank you so much, sir.
Yeah,
If
that's
anyone
my future.
Okay, sir. If anyone have any question, you can send the question to the WhatsApp platform because our time is fast spent and we'll be wrapping up. So for the PowerPoint for the presentation is going to be sent to the WhatsApp platform. So I'd admonish every one of us to watch out for it. Just look out for the presentation on the WhatsApp platform so everybody can have access to it to be able to download it. So thank you very much, our speakers once again. Our two speakers have been wonderful tonight and we are really grateful. Thank you so much to everyone who has joined, to everyone who has been a part of this conference. Thank you for joining us. And we continue tomorrow again. The conference continues tomorrow and would be expecting you all. Tomorrow is also going to be a panel session and you don't want to miss it for anything. So we'll be wrapping up at this point. Thank you all for joining. Have a wonderful night rest. I believe you all jotted one or two things. So you can go through your jottings. Let's continue the chat in the group. Yeah, thank you so much.